In this video, I'm going to teach you everything you need to know about psoriasis. So, psoriasis is a common chronic inflammatory skin disorder that presents with scaly erythematous plaques, typically on extensor surfaces of the skin. So, the extensor surfaces like elbows and knees are commonly predisposed. So, in predisposed individuals, the disruption of the epithelial barrier, this leads to activation of antigen presenting dendritic cells, and then subsequently this leads to self-reinforcing inflammatory cascade, which is characterized by recruitment and activation of T helper and proliferation of keratinocytes. So here the disruption of epithelial barrier, here this leads to activation of antigen presenting cells and subsequently to a self-reinforcing inflammatory cascade, which is characterized by recruitment of T helper cells and then the proliferation of keratinocytes. Histologically, this psoriasis is characterized by hyperkeratosis, which is thickening of stratum corneum, and confluent parakeratosis, which is called retention of the nuclei. If you can see this area here, you can see the retention of the nuclei in the stratum corneum. So stratum corneum, it should be lack of nuclei, but if the nuclei is present in the stratum corneum, that means that is called parakeratosis, which is a characteristic feature of psoriasis, and this produces characteristic silvery scale on gross examination. So this is the appearance of silvery scale on gross examination of a psoriasis patient. So if you can see here, this is the epidermal hyperplasia, which is also called acanthosis, with elongated rete ridges correspond to typical erythematous plaques. And another characteristic feature of psoriasis is micromunro abscesses. This is the neutrophilic foci in the stratum corneum and epidermis, which may coalesce to form the microabscesses, which are also called Monro's microabscesses. In addition, the epidermal cell layer superficial to the dermal papillae may be thinned and contain dilated blood vessels, which leads to pinpoint bleeding when the scale is removed from the plaque, which is also called Auspitz sign. So if you see the image, the bleeding point here, you can see that is called Auspitz sign. The treatment for psoriasis is topical corticosteroids like defloresone and vitamin D analogs like calcipotriene and calcitriol. Vitamin D analogs helps in inhibition of T cell and keratinocyte proliferation and stimulation of keratinocyte differentiation. Corticosteroids also have an inflammatory and anti-proliferative properties. Their mechanism of action is complementary to vitamin D analogs, and the two agents will work very well in combination.